What is PRP? Platelet-rich plasma, PRP, is a component of blood that's thought to promote healing and tissue generation. PRP therapy is used to treat tendon or muscle injuries, stimulate hair growth, and speed recovery from surgery. It's also used as an experimental or alternative treatment option for erectile dysfunction, et Peyronie's disease. In large men's sexual performance. There's currently little research on the effectiveness of PRP for ED. In this article, we're going to break down what scientists have found so far. We'll also look at alternative treatment options and potential side effects of PRP therapy. How does it work? Your blood is made of 4 different components: red blood cells, white blood cells, plasma, and platelets. Plasma is the liquid part of your blood and makes up about half of its volume. Platelets are critical for helping your blood clot after an injury. They also contain proteins called growth factors that help speed up healing. The theoretical benefit of PRP for ED is to make the tissue and blood vessels in the penis healthier. To prepare PRP, a medical professional takes a small sample of your blood and spins it in a machine called a centrifuge. The centrifuge separates the plasma and platelets from the other parts of your blood. The resulting PRP mixture has a much higher concentration of platelets than regular blood. Once the PRP is developed, it's injected into your penis. This is called the Priapus shot, or P-shot. The P-shot is a quick procedure, and you'll likely be able to leave the clinic in about an hour. You also don't have to do anything to prepare in advance for the procedure. What does the research say? Many clinics offering PRP for ED claim that it's effective, but there's limited scientific evidence to support their claims. Using PRP for ED is experimental, and its effectiveness is still under review. A 2020 review trusted source looked at all the research available to date on PRP therapy for male sexual dysfunction. The review looked at 3 animal studies and 2 human studies for ED. The studies didn't report any major adverse reactions to PRP therapy. The researchers concluded that PRP has the potential to be a useful treatment option for ED. However, it's important to keep in mind that the studies had small sample sizes, and there weren't adequate comparison groups. More research is needed to understand the benefits of PRP treatment. The current evidence is mostly anecdotal. How does PRP compare to other ED treatments? At this time, it isn't clear if undergoing PRP therapy will help improve symptoms of ED. Traditional treatment options might be a better alternative until more research is available. Many people with ED have success with traditional treatment options, which usually target the underlying cause of ED. Your doctor can evaluate you for potential causes of ED, such as heart disease, high cholesterol, or diabetes, and recommend the best treatment option for you. Common ED treatments include medications. ED medications allow the blood vessels in the penis to relax and increase blood flow. Lifestyle changes. Becoming more physically active, eating a healthier diet, and quitting smoking all have the potential to improve ED. Talk therapy. Talk therapies might help improve ED if it's a result of psychological causes, such as anxiety, stress, or relationship problems. Targeting underlying conditions. ED is often caused by an underlying condition, such as high blood pressure, obesity, and heart disease. Treating these conditions has the potential to improve erection quality. How much does PRP cost? Few insurance plans currently cover PRP because it's still considered an experimental treatment. The cost of the P-shot can range widely among clinics. According to the Hormone Zone, The P-shot procedure costs about $1,900. However, some clinics may charge up to $2,200 for treatment. According to the 2018 Plastic Surgery Statistics Report, the average doctor fee for a PRP procedure was $683, not including facility and instrument cost. Finding a doctor. If you're interested in having PRP treatment for ED, talk to your doctor. They can answer your questions about PRP and refer you to a specialist who performs the treatment. Globally, there are at least 683 registered clinics that can administer PRP for ED. PRP is usually performed by a doctor or surgeon. However, laws on who can perform the treatment may vary between countries. When looking for somebody to perform PRP, check their medical credentials to make sure they're licensed by a medical board before you make an appointment. If possible, you may also want to speak to one of their previous clients to see if they were happy with the results. Risks and side effects. The 2020 review mentioned earlier found no major adverse effects in the study participants. However, researchers can't say whether or not PRP is a safe treatment for ED until more research comes out. As of now, there have been few clinical trials, and the sample sizes have been too small to make any conclusions. PRP is unlikely to cause an allergic reaction since the substance being injected is coming from your body. However, as with any type of injection, there's always a risk of complications, such as infection, nerve damage, pain, including pain at the injection site, tissue damage, bruising. Takeaway: PRP therapy is still an experimental treatment. At this time, it isn't clear if PRP can help treat ED. The procedure is relatively expensive and isn't covered by most insurance companies. Early research looks promising, but until studies with large sample sizes and control groups come out, you may want to stick with traditional ED treatments. If you're having trouble getting an erection, it's a good idea to talk to your doctor. They can test you for underlying medical conditions that may be causing ED and recommend an appropriate treatment.